Many thanks. Next question comes from Jonathan Levy, Radio News Hub.
Thank you very much. You talk about restricting booster shots, but what about age range? Some countries looking at 16 to 17-year-olds. What are the pros and cons?
Yeah, thanks, Jonathan. A super important point. When it comes to age ranges, we come back to the original advice. We're in a situation now where many countries are beginning to move into very young populations that are at very low risk of severe disease or hospitalization, while healthcare workers who are dealing with infected people on a day-to-day basis in front of a roaring surges of Delta virus in many parts of the world are going into that completely unprotected in terms of vaccination. Similarly, older populations in such countries unprotected. So, Jonathan, again, the Director General's position, our position would be we have to really get serious and take a global view on this. If we get every remaining country now to at least 10% coverage by the end of September, we will have gone a long way toward protecting healthcare workers and protecting older populations in most countries. So our preference and our strong recommendation from a global public health perspective is we prioritize those populations before we start going into the younger populations, teenagers, etc. Yes, they're at risk of COVID, very definitely, but less severe disease and hospitalization. And in the face of scarce products, really we need to look at this from a global perspective and try and protect those at highest risk. That will be our goal through September, through the end of the year. And thank you, Jonathan, for highlighting it. It's so important that we prioritize the right populations in the right order.